Happy Thursday, everyone. It's time for my Thursday thoughts. Wanted to tell you about one of my experiences this week. I went into a provider's office to drop off some studies and some information about what we do. And the first thing the girl said to me is, "Oh, we use the study on all of our patients." And I explained scoring 4 or higher, that put him at a fall risk. And she said, "Oh, all our patients score 4 or higher." I didn't really know how to respond to that. I set up a breakfast so that we could explain to the providers what we do, and I got in my car and realized they're not doing anything. And that's kind of a common theme that I'm seeing as I'm going through these doctors' offices. They're documenting that they're scoring 4 or higher. A lot of times it's 6, 7, 8 on that study. Yet they're not doing anything. They're not putting any kind of intervention in place. They're not having people like us, go into the home and make recommendations. And I thought, well, if a patient comes in with elevated blood pressure, they're going to prescribe medication. Their labs are out of whack, they might run some more tests. Yet, if they score high on the study, they're not doing anything about it. And that's the leading cause of injury with our senior population. So why aren't we doing that? And that goes back to what so many providers have told me, that their concern with sending people like us out is we're going to make recommendations that a patient can't afford. And that brings me back to another situation that happened this week. I had a loved one who had some ongoing issues, finally got into a specialist, and the doctor ordered some medication. They went to the pharmacy to pick it up, and after insurance, it was $389. So my loved one walked out of the pharmacy without getting that medication because they couldn't afford it. And I thought, well, the doctor didn't think about that when they prescribed the medication. They provided the best intervention that they thought for my loved one. And that goes back to what we do. We're going to recommend what we think are the best recommendations to reduce fall. And just like my loved one, patients have the right to make the choice if they want to do that or not. We need to at least educate and give them an option. People that are scared of falling are going to find the resources to get that equipment. Most of our recommendations are minimal and very cost effective. I'll give you a great example. If a patient falls and breaks a hip and has Medicare, no secondary, they go to the hospital, they're going to accrue a few $1,000s in bills from a surgery. They're going to go to rehab for 30 days. After day 20, starting day 21, they're going to be accruing about a $200 copay. So they're going to walk out of rehab with a $2,000 bill. And that same patient, I might have been able to go in and make recommendations for that bathroom they just fell in for probably less than $200. Um, so those are just my thoughts, some of my frustrations when I'm out in the community. We need to be more proactive. If we are recognizing that someone's a fall risk, we've got to do something about it. And people like us, Chris and I, can go in and not only make those recommendations, but educate patients. The education is huge, and guide them to some resources that could help them in the community. And those are my Thursday thoughts. You guys have a great day.